everyone, in today's video we're going to discuss how to care for patients with emphysema. First, we're going to go over what emphysema is and how it affects the patient. Then we're going to apply the nursing process and go over what we can do as the nurse to help the patient. So let's jump right into it. So what is emphysema? Emphysema is a type of chronic pulmonary disorder in which there is abnormal distension of the alveoli. Alveolar walls and capillary beds reveal marked destruction, and this is a process that does occur over a long period of time. By the time the patient is actually diagnosed with emphysema, the lungs are usually already permanently damaged. Emphysema is the most common type of obstructive lung disorder and a common cause of disability. In emphysema, alveoli lose elasticity, decreasing the alveoli's ability to expand. As a result, the air that the patient would normally breathe out becomes trapped inside of the lungs. Alveolar walls break down, forming one large sac, so the alveoli no longer have multiple air spaces. Capillary beds that would normally be located within the walls of the alveoli become destroyed and replaced with fibrous scar tissue. And the scarring from that fibrous tissue, along with alveolar destruction that's taking place, is going to lead to this patient having poor gas exchange when they respirate. Large air sacs may appear over the lung surface. These large air sacs are called bullae or blebs and can sometimes rupture. This would allow air to enter the thorax when the patient breathes, causing something we know as pneumothorax. Signs and symptoms. So what are we going to see in the patient with emphysema? Well, we'd see shortness of breath even during periods of rest, and this is actually one of those first signs and symptoms of emphysema. They may also have a chronic productive cough with purulent sputum. As the disease progresses, they may also display breathlessness. These patients tend to have a rigid chest cage, which makes it very hard for them to breathe in. One of the most famous signs and symptoms of emphysema is going to be that barrel-shaped chest. You may observe that the patient uses their accessory muscles to breathe, such as their jaw, neck, and intercostal muscles. They also tend to have very long and labored expirations, along with wheezing. Now, here are some signs and symptoms you'd see in a patient with advanced emphysema. The patient with advanced emphysema looks anxious, pale, and drawn. They often speak in short, jerky sentences. You may also notice that these patients lean slightly forward when they sit, as shown in this picture here on the right. This is known as the tripod position. The patient's neck veins are distended when they breathe out. There will be decreased breath sounds upon auscultation, as well as wheezing and lung crackles. Their heart sounds are going to sound diminished or muffled. Now, patients with advanced emphysema, they're still going to have that barrel-shaped chest, but you may notice that they're pursing their lips to breathe. Level of cognition may become impaired, so memory loss, drowsiness, confusion, poor judgment. And this decrease in level of cognition pretty much stems from the low amount of oxygen that's reaching the brain. Now, advanced emphysema can also cause a condition called carbon dioxide narcosis. This happens when there's a toxic amount of CO2 pooling around in the patient's blood. Carbon dioxide narcosis can cause lethargy, stupor, and coma. Diagnostic findings, so chest radiography, fluoroscopy, and CAT scan may reveal hyperinflated lungs. Pulmonary function studies may show increased total lung capacity, increased residual volume, decreased vital lung capacity, and forced expiratory volume. Those ABGs are going to show respiratory acidosis and hypoxemia. So the main goals of medical treatment for a client with emphysema are going to include slowing the progression of the disease, improving their quality of life, and treating the obstructed airway. To achieve this, the patient with emphysema may be prescribed things like bronchodilators, aerosol therapy, inhaled or oral corticosteroids, supplemental oxygen, antibiotics, or physical therapy. The bronchodilators help to improve gas exchange and will help to dilate the patient's airway by decreasing spasms and edema. Aerosol therapy with nebulized aerosol helps the tracheobronchial tree to deeply inhale the prescribed bronchodilators and mucolytics. Corticosteroids, again, they may be inhaled or they may be taken orally. They assist with bronchodilation and they help to remove secretions from the lungs. Physical therapy. This is indicated to increase ventilation using deep breathing, coughing, chest percussion, vibration, and postural drainage. Antibiotics as well as oxygen may also be prescribed. So now the fun part. What are we going to do as the nurse to care for the patient with emphysema? Well, remember, before we do anything in nursing, we have to apply the nursing process. So our first step to caring for the patient with emphysema is to assess. Because we can't plan care, develop interventions, or establish a baseline if we don't know anything about how our patient is responding to the disease. So some things to assess. We want to assess their respiratory status, respiratory effort, respiratory rate, and their respiratory pattern. Assess the patient's breathing pattern. Does this patient have diminished breath sounds? Are their expirations prolonged? Do you see any evidence of dyspnea? Is the patient using their accessory muscles to breathe? Observe for that barrel-shaped chest. Ask the patient about activity tolerance. How often do they find themselves getting tired during activities? Check the color, consistency, odor, and amount of their respiratory secretions. Also, assess if the patient is able to expectorate secretions. Observe and assess for signs and symptoms of infection. And while noting these symptoms, you want to ask the patient what they do to relieve their symptoms. Some of the most common nursing diagnoses for the client with emphysema are ineffective airway clearance and impaired gas exchange. Of course, ineffective airway clearance is going to be the most important diagnosis of the two, because without an airway, we have no patient. So airway is always going to be priority, then breathing, then circulation. Our plan is that our patient will have a patent airway with sufficient airway clearance and that they will maintain gas exchange. But keep in mind that your planned outcomes should always be realistic and individualized for that patient. So you could be taking care of 2 patients with emphysema, but your planned outcomes could be completely different for each patient. But that's just nursing care in general. Nursing care should always be individualized and patient-centered. Our first diagnosis, ineffective airway clearance. So let's go over some interventions we can implement to help our patient achieve a clear airway. We're going to want to auscultate their breath sounds at least every 8 hours. This is an important intervention in making sure that the patient isn't experiencing any airway obstruction or airway resistance from the excessive mucus they're producing. You want to encourage the client to cough and clear those secretions to keep the airway clear and improve ventilation. You could also suction the secretions, but only if needed, because these clients are at high risk for inadequate oxygenation. Perform postural drainage with percussion and vibration twice a day. This promotes the movement and expectoration of secretions to achieve airway clearance. Observe for dyspnea, restlessness, anxiety, or the use of accessory muscles to breathe. These could all be signs that the patient's airway may be obstructed. You want to increase the client's fluid intake to 3 liters a day as long as it's not contraindicated. So, for example, this intervention would probably be contraindicated in a client with heart failure. Teach your client the importance of humidifying the air that they breathe. Humidification will help to keep respiratory secretions moist, making them easier to expectorate. Teach the client the early signs of infections, such as increased sputum production, changes in sputum color and texture, fever, increased coughing, and dyspnea. Administer bronchodilators via nebulization to open the patient's airway. This will allow them to breathe and expectorate secretions better. Teach the client to use pursed lip breathing to improve ventilation and mobilize secretions. Encourage the client to breathe using their diaphragm, meaning that they would let the abdomen rise when they take a deep breath in and contract the abdominal muscles when they breathe out. Explain to the patient that diaphragmatic breathing will decrease the workload on the upper thorax muscles. In a way the client can know if they're doing this breathing exercise correctly is by placing one of their hands on their chest and their other hand on their abdomen. The hand placed on the abdomen should rise and fall with each breath, while the hand placed on their chest should stay still. Okay, our next diagnosis, impaired gas exchange. So let's go over some interventions we can implement to improve gas exchange in our patient. So we could put this patient in a high Fowler's position to promote lung expansion, or we could turn them to the side to promote lung aeration. we want to promote pursed lip breathing and teach the client that pursed lip breathing will open up the airway and allow them to exhale easier. We want to monitor our patient's level of consciousness. Changes in the patient's mental status could be a sign of inadequate oxygenation. Now, of course, if our patient is prescribed oxygen, we want to monitor their oxygen levels. This oxygen is usually given via nasal cannula or catheter. The oxygen rate should be set no more than 2 to 3 liters per minute. We want to monitor the patient's ABGs and pulse oximetry, of course. We want to teach the client that deep breathing and coughing exercises, as well as the use of an incentive spirometer, will promote lung expansion and prevent atelectasis from occurring. So after we've implemented interventions, we want to evaluate the client. We want to see that their airway is clear of secretions, their breath sounds are clear, ABGs and pulse oximetry results are within baseline. We want to see that the client is alert and responsive. We want to see that the client is properly demonstrating the ability to do the pulmonary exercises and abdominal breathing techniques you taught them. But wait, there's more. Client and family teaching, but I promise that after this, we only have one more slide left to cover, and then I'll let you guys go and be great. There was already some slight teaching included in the interventions we went over in the last 2 slides. But there are still some things we want the patient and their family to understand before discharge. For example, medication compliance. We want to stress to the patient how important it is that they comply with the medication regimen prescribed by the doctor. This means to not skip doses or take more than what the physician ordered. Teach them about the adverse effects associated with their medication and let them know that they should contact the physician if they begin to experience any of them. Tell them they should also contact the physician if their medication isn't helping their symptoms, if their symptoms worsen, or if new symptoms begin to appear. Explain the importance of scheduling follow-ups. You want to teach the patient with emphysema the signs and symptoms of respiratory infection, and to contact the physician if those signs and symptoms begin to appear. They also need to avoid close contact with people that have a respiratory infection. Tell them they should continue to increase their fluid intake at home, eat a well-balanced diet, and we're actually going to talk more about what the ideal diet is for the emphysemic patient in the next slide. Take frequent rest periods throughout the day. Activities should be spaced out to prevent the client from feeling fatigued or short of breath. They should also avoid dry, heated areas because this can activate symptoms. Teach the client to humidify inspired air, especially during the winter. Teach them some breathing exercises they can do at home, such as blowing out candles or blowing a small object across the table, like a pencil or pen. Teach them that pursed lip breathing will help control their respiratory rate and depth. Patients with emphysema are at risk for malnutrition, and different factors can lead to it. For example, shortness of breath and trouble breathing may hinder the client's ability to chew and swallow their food. Lack of oxygen to GI cells may lead to stomach ulcers and anorexia. Peristalsis and digestion may slow down, causing the patient to lose their appetite. Also, remember that these patients have very labored respirations, so this is going to increase their calorie requirements. Or the client with emphysema could be having so much anxiety about them having trouble breathing that eating may just be the last thing on their mind. So what we want to do is correct malnutrition if they are malnutrition, but if they're not, our main goal is to prevent it. We want the client to increase their calorie and protein intake, encourage small frequent meals instead of large, less frequent meals. Teach the client that these small frequent meals should be nutrient dense to help them increase their protein and calorie intake while still minimizing fatigue. Encourage the client with emphysema to increase their fluid intake between meals instead of with meals because the fluids may cause them to feel full before they even finish their food. Now, if the client is obese, we want to encourage them to lose weight to improve their breathing. Well, that wraps up our video on emphysema. Please be sure to like, comment, share, and subscribe. Remember to never give up, and as always, thanks for watching.